And thank you all for being here for this important set of conversations today. It's great to see so many faces in the room, and it's an important time for this talk. So my name is Michel Nischan, and I'm going to talk about the impact of significant emotional event on my journey in my career, moving from a chef to a CEO. So there's a movie called Almost Famous. Did anybody see it at all? Anybody out there, right? Okay, well, that's me. I was on a trajectory as a celebrity chef. I've been lucky enough to win a few Beard Awards, but I now am solely devoted to trying to do something about the food insecurity and the inequity in our food systems that really result in tremendous numbers of people, especially struggling with poverty, now struggling with diet-related diseases. I was a chef for over 40 years. Spent summers growing up on my grandfather's farm in Morley, Missouri, so I really grew up understanding the connection to good food really started with good agriculture. And I thought I had it figured out. Starting in the late 70s, throughout my career, I went out to the countryside, met farmers, started paying them in advance to get better food for my customers so that my customers could enjoy something like a real ripe tomato instead of those round, pink, sandy, mealy things that you find in the grocery store in the middle of winter, except for in California because you guys have a 12-month growing season. And I thought I was doing really well, but about a third of the way through my career, I had my significant emotional event, and that's when my son Chris was diagnosed with type 1 diabetes. And I learned, and my wife learned, from our very forward-thinking endocrinologist at the time that what we would do with Chris's food strategy would have more to do with the success and the quality of his long-term outcome than any other thing that we could do. And I was kind of psyched. I said, I've got this. I'm a chef. But the more we changed what we were doing at home with our food, it was not reconciling with what I was feeding my customers. I mean, yes, I was doing local, organic, sustainable, but there's organic butter, there's organic cream, there's organic sugar, there's organic all-purpose flour, and my recipes were replete with those ingredients. And I found myself losing sleep because I was feeding my customers something I wouldn't feed my family. So in 1997, I created a restaurant called Heartbeat, and the first W hotel that ever opened was a restaurant of well-being based on local, organic, sustainable, no processed food of any kind. Very controversial. We got 3 stars in the New York Times. We got 0 stars in the New York Post. So everybody was talking about us, which was kind of cool. Yeah, it's kind of funny. And it's still that way today. But I got invited to all these think tanks, Harvard School for Public Health, Tufts University, Culinary Institute of America, a lot of really great think tanks. Started learning more about type 2, the scale of it, the real opportunity there because of its preventability, because of its reversibility in the early stages. But then I learned that the majority of people that are struggling with the disease or destined to get it live at income levels that disallow them from being able to act on that type of a lifestyle change. Here we go. There we go. So here's the deal, 60 million Americans food insecure, 40 million Americans that rely on SNAP, $4 a day for food. But what a lot of people don't know is when they run out of SNAP, these families, actually about 8 million households, have $2 to spend on dinner tonight for a family of 4. That's 50 cents a person. So we think about how inexpensive it is to do this, that chicken and vegetable dinner on one side of the plate. But if you have $4 on a day, are you going to put it into one meal that you divide between 4 people? No, that's what's for dinner tonight. When you have $2 to spend on a family of 4 for dinner, and a grocery store is a block away from your house, and you go there and you find broccoli at $2 a head, are you putting broccoli on the dinner table tonight? The answer is no. So bottom line for millions of Americans, broccoli cannot be the easy choice. We talk about making the healthy choice the easy choice. If you can't afford it, you can't choose it. Pretty much that simple. So I believed early on that perhaps the real only barrier might be lack of affordability. Study after study, back when we founded Wholesome Wave, talked about all the cultural reasons why people struggling with poverty weren't making healthier food choices: lack of education, lack of geographic access, the built environment. But, to me, it's simple. If they can't afford it, they're not going to buy it. Doesn't matter what they know. You can be an expert on broccoli. If you can't afford to put it on the table tonight, it's not going on the table. So that's why we founded Wholesome Wave, on the principle that poverty should never be a barrier to affording something as simple as fruits and vegetables. We started by doubling SNAP when spent on fruits and vegetables at farmers markets. We learned that when people can't afford produce, they absolutely buy it, even if they don't know what it is. I saw people buy kohlrabi because it was so cheap. It was 80 cents a pound before the incentive, so it's 40 cents a pound. And they demand what to do with the kohlrabi because they can afford a whole lot of it. That was a remarkable eye-opening for me. More importantly, aside from the public health benefits that come, the impact on local businesses participating in incentive programs, all of those things, self-esteem is perhaps one of the greatest outcomes that we see when a family struggling with poverty because of circumstances beyond their control. They know their kids should be eating more vegetables, and they actually can put that on the table and watch their kids' health improve, watch their attitude improve, watch their performance in school improve. This is a powerful, powerful thing. And change happened. We were able to prove that consumer attitudes, when they encountered affordability in low-income communities, matched whole food shoppers. We were able to prove that farms put more land in production, made infrastructural investments to their operations. Small grocers put refrigerated systems in. That's a business investment. You hire more people. There's an economic impact to this. So as a result, in the 2014 Farm Bill, the Food Insecurity Nutrition Incentive Program passed $100 million in federal funding to double SNAP when spent on fruits and vegetables anywhere in the country. But that's not enough. $100 million amongst a population that spends $60 billion a year just in SNAP or food stamps isn't enough. So we felt, because we had some success in ag policy, maybe we could use some of those learnings to influence health policy. So what were the learnings? One is doubling SNAP was enormously successful because it was simple. 2-for-1 fruits and vegetables, whether you're Cambodian, Laotian, Somali, Haitian, Appalachian, doesn't matter. Everybody understands 2-for-1. So everybody understands it. Translates across all ethnicities, right? Doesn't matter what language you speak. 2-for-1. Another thing that we learned, Americans in poverty spend over $100 billion a year on retail food. Think about the potential for a citizen-led movement there. 60 million Americans who are having trouble affording turning the lights on in their house spend actually close to $200 billion a year on retail food. If we could unite that consumer base and they actually understood the power that they held, there's a citizen-led movement opportunity, and we're looking there. America spends over $1.4 trillion a year just on diet-related diseases, treatments, therapies, lost productivities. So you look at the tension between those two things, this powerful economic consumer base and what diet-related disease costs us, and I think there's some potential there. So we created fruit and vegetable prescriptions back in 2009. Took us a while to really iterate and get it off the ground because it's very expensive. You need multi-stakeholders in a community. You need your food access points. You need people in the public health sector, federally qualified community health systems, public hospitals. Imagine the current reality: somebody passes out at one of their 3 part-time jobs to equal a full-time job because they're feeling dizzy at work. They go to the emergency room and the doctor says, you're hypertensive, your A1C is high, you're obese. If you don't do something to change what you're eating and exercise more, the next time I see you, you're going to have type 2 diabetes. Go with God. That's the current reality, right? So we started changing that and flipping that. Instead of waiting for someone to get type 2 and then paying for their medicine, what if we invested in the food up front? So we got to a point over the last couple of years where we've been partnering with Target stores in Los Angeles, Houston, Miami. We're poising for a national expansion, and I'm going to go to here where we can just let these guys talk about it for a sec. Go ahead. Thank you. Sweet stuff, right? So Ms. Aguiar has lost 37 pounds, and the prescriptions weren't for her. The prescriptions were for her daughter, and these are the outcomes. I mean, they're impressive, right? When we look at this type of an impact, it really opens our mind to the fact that there's real possibility here. And there's a lot of financial resource out there, $200 billion in sales. What happens and what role can incentivizing just a little bit of that spend play in shifting the way that money gets spent? When I think about this, there's a win-win-win for everybody engaged, including the families. But more than that, just imagining the possibilities. Fruit and vegetable purchases being reimbursed through Medicaid. Employers providing fruit and vegetable incentives for their low-wage employees. And what if we could get them a tax credit for doing that, to encouraging a healthier lifestyle, more productive employees, a better, stronger workforce? Imagine that. $100,000 a year for one patient to be on dialysis, or $100,000 a year to increase the fruit and vegetable consumption of 250 people, 2 servings a day, every day of that year. Look at the study, name the study, whether it's the Oxford studies, NHANE from the CDC, 30 to 60 people of those 250 people aren't going to need dialysis. So $100,000 saves $3 to $6 million. That's amazing. That's a real return on investment. So at those numbers, and 377,000 Americans will be needing dialysis this year, this type of approach allows us to eat our way out of the national debt. And wouldn't that be delicious? Thank you.